So what I'm going to do next is introduce our panelists. We have Amanda Skarlupka, who is our newest senior data program manager at Vivli, who is actually running this program now. So she really hit the ground running and has a pretty big assignment in running the AMR platform. Katherine Perez from Pfizer. We have Kasim Henriquez from the University of Oxford, and Akligoh from Northeastern, who's finishing up his PhD and won the Student Award for the AMR Data Challenge. I'm going to hand it over to Amanda to talk just for a few minutes on the AMR Data Challenge itself. So Amanda, over to you.
Thank you, Rebecca. I am Amanda Skarlupka, and I'm the Senior Program Manager here at Vivli. And as Rebecca mentioned, I'm overseeing the AMR register. And so I'll be introducing that to you quickly today. So AMR, or antimicrobial resistance, surveillance data is collected by our industry members to monitor the susceptibility and resistance of microbes to those industry members' antimicrobials. These surveillance programs are usually global in scope, and they monitor changes in resistance patterns and trends at the global, regional, as well as local levels, and provide those healthcare practitioners with the susceptibility data to support the appropriate use and prescription of antimicrobials. However, prior to 2022, the AMR community recognized that there was a vital gap in the accessibility of this data. So industry members were collecting and generating all of this data, each individually, but accessing that data and actually analyzing it for research purposes was very difficult. So in 2022, the AMR register was initiated, and we have since shared these high-quality industry surveillance data sets through the innovative and fully searchable platform, the AMR Register. And we are bridging the silos between academic, private, and public information. Researchers have been able to successfully use the data on the AMR Register to detect trends in multi-drug resistance over time, to inform national and international policy and antibiotic stewardship, and then finally, to model future resistance trends. The 10 AMR register members contribute their data sets for sharing. These members have been generating local antibiotic susceptibility data for a very long time and have committed to sharing this data with the researchers, public health bodies, with public health bodies and healthcare professionals. And we work with them to help improve the understanding of resistance trends, inform those appropriate antibiotic and vaccine use over time, and thereby helping increase the surveillance capabilities globally. The data sets available on the register collectively include over 1.1 million different isolates with a total of 14 different data sets. They're collected from 2004 to 2023. It covers 89 different countries, tests 82 different antimicrobials, and it has information on over 600 different organisms. These are some fantastic data sets, and some of our researchers that come in and request data, we've been receiving requests from researchers around the world. So here are some of the first requests that we've received from some of the countries. So for instance, in year one, we saw our first requests come in from United States, India, Australia, and then over the years, it's continued to grow. And then in year 4, we finally saw our first researchers coming in from Argentina, Brazil, Cameroon, and Switzerland. So we've seen a great expanse of our outreach to different researchers around the world, and we're excited to continue that work. And with that, I hand it over to Katherine Perez to introduce the AMR Data Challenge, which looks to use the data that is provided by our members.
I'll just put this. Whoops. Okay. Good morning, everyone. My name is Katherine Perez. Thank you, Amanda, for a lovely introduction of the AMR register itself. And thank you to the Vivli team for inviting me here today to be part of this conversation that is very near and dear to my heart. I am the Senior Director over the Infectious Disease Surveillance and Real-World Evidence Generation at Pfizer. And it's really carved into the biggest sort of surveillance platform that we have, which is called the ATLAS program. For anyone who is unfamiliar with the ATLAS platform, it does stand for Antimicrobial Leadership, no, Testing, Leadership, and Susceptibility Program. And it was essentially a culmination of different surveillance programs that Pfizer has had that went by the names of TEST, INFORM, AWARE, and were essentially consolidated into one blanket and called ATLAS. It's a data set that does go back to 2004, and we're continuing to update that, obviously. And it is a global surveillance network with 226 sites around the world. So we do capture quite a bit of a regional diversity in terms of the antimicrobial, the AMR data. And back in 2017, Pfizer did take a very bold move in the spirit of transparency and data sharing and actually launched a website, atlassurveillance.com. You can log in right now and get yourself an account. It's free and public, fully searchable to everyone. And it essentially hosts all of our raw data for antimicrobial susceptibility. And it was launched in a way where you can essentially query the site and ask a question, as opposed to just sort of downloading the data set and then sort of sitting there with a whole ton of data and not really knowing where to begin. We did have certain prompts where you can say, I'm interested in the E. coli resistance rates over the last 6 years in these territories, right? And then you can really slice and dice the data in different ways. But behind all of that, there obviously does exist a very boring data set that someone can download. And we were interested in trying to identify a way and a means to share that. And we decided to partner with Vivli when they established the AMR register. And one of the big drivers for us was that we do have, because we have such a large global footprint, we do have a lot of data in LMIC, in the LMIC areas, and that data is, very, very difficult and limited. And so we wanted to make sure that we could provide that data in as many different formats and ways as we could. And so we still host the data on the ATLAS website, but obviously are also hosting it with the Vivli AMR register. I will also say, my full disclosure, I do have a very unique perspective with this data challenge in particular, as I've served as on the panel of judges for the different data challenges since, I think on all of them, maybe not the first one, but I have since then. And I also, am part of contributing the data. So it's really neat to see how the data's been used by all these different researchers. It's been fantastic. All right. So just to give an overview of the actual requirements and the core components that we're looking for this data challenge in particular. These are the core objectives. Okay. I'm not sure if there's a timer or something on here. Okay. So First, obviously, we wanted to really engage researchers and the entire scientific community worldwide. The AMR register is a resource for everyone, as we've mentioned, and the goal is, again, to really have broad participation from lots of different research teams with different backgrounds, and really have sustainable participation. And I think we've really covered a lot of ground on that. Second, the data challenge really does aim to generate, to actually have new insights and applications, and think of creative ways to look at the data that by anyone else, you might look at it and say, that is the most boring data set I've ever seen in my life, because it is regulatory grade data. These are reports that we submit to accreditation agencies around the world, meaning that they're very high caliber, but they're not very spicy. And so how do we get what we want out of the data, right? How do we actually learn what we really want to know, which are, going back to clinical outcomes, or, potentially public health, outcomes with respect to things that I would have never thought of before, but we'll get to that later. And then we obviously want to promote the use of the AMR register. And I will say that, I think Pfizer, having really launched that first of its type of website back in 2017, put a little bit of pressure on some of our colleagues in pharma to say, okay, all right, challenge accepted. And so they found the Vivli AMR register to be a really great place where they too could share their data. And, it's peer pressure, suppose. So it works, I think it works pretty well. So in terms of the participants and the awards, we did, if we just kind of take a closer look at what makes this data challenge in particular unique, I will say, this data challenge is an open challenge, so it's not focused. And I think it really could be focused in the future. I think when we first launched it, we really didn't know exactly what we were going to get. Again, like I said, these databases are very boring. So we were interested in understanding, what do people see? What do the people think about, the use of this information? And we were curious to really understand what kinds of ideas that this would generate. So we've left it as an open challenge, and we've talked about having different spin-offs and essentially doing that in the future. And then from there, I will tell you, we were very, very, very thoughtful about essentially how to carve out the different components of the different requirements for the teams. We wanted to make sure that we had at least 2 to 5 members, because as we've heard in other sessions earlier today, we know that you can't do this in a vacuum, right? We need to have these different perspectives. You need to have multidisciplinary teams, and that has to be at the core of this. So that was certainly a non-negotiable. And then really, we wanted to encourage collaboration, recognize that the best solutions come from those diverse perspectives. Then when we look at the prizes and the incentives that were available to the awardees, the finalists, it was coming from what I thought was a substantial prize pool, but I'm only $50,000. It's not $3 million, unfortunately. When I heard that, I said, oh my gosh, that's amazing. I wish we could support this data challenge with that kind of funding, because it's night and day, certainly, but we have a sizable prize pool of $50,000 that we do provide the awardees, and the prizes are split between grand prize and impact prize, innovation, and student awards, all distributed compliantly. And lastly, we have the Vivli AMR Open Data Reuse Data Challenge Welcome Open Research Collection, which provides all of the researchers the opportunity to actually publish on their work, and that's been really fantastic to see. Lastly, in order to really select from the team participants the awards and prizes lastly, in order to select from the team participants, the awards and prizes are to be delivered. We have a judging panel. I've been fortunate enough to be a participant on that panel. The panel has grown, it's fabulous. We have lots of experts in AMR, and now we also have an expert in machine learning and artificial intelligence, because we've had so many submissions that have started to use these different models. And I mean, I'll be honest, it's certainly not my area of expertise. And so sometimes I look at it and I'm like, well, that's magic, you know? And so it's been really helpful to have someone with that background who can really speak to whether it's a valid use of the modeling concept and it's something that would be reproducible in the future. So the crux of it, the key milestones, as I guess you could say, of the AMR Data Challenge really do include teams submitting their expressions of interest, and they do this through the AMR register. Okay. And then, you know, the data sets are requested. They provide a very brief overview of what it is that they're, you know, planning to do. It's like 300 words. And then after we've all had a chance of reviewing those, they do have access to the database. They have 60 days to download, analyze, and write up the report for their final submission. Then they submit the final report back to Vivli, and Vivli coordinates a fantastic review process, which, you know, I've been a part of and can attest to. And the judging panel then has 30 days to review all of the final reports and provide scores and assessments for selecting finalists. Then the finalists are invited to their Shark Tank, you know, session with the AMR register, where they essentially provide a 10-minute presentation, and it's 10 minutes. I mean, it's great. It's fabulous. 10-minute presentation on the research that they've conducted, and then we get to ask questions. We go back and forth, and I mean, the feedback is great. We really gain better understanding of what it is that the researchers are trying to accomplish. At which point, Vivli will announce the awardees and finalists, and all entries that, you know, will receive the final report and their final presentations. So again, the judges make their assessments for finalists based on we have very strict methodology that has been consistent throughout. And we really are looking at, you know, the study design, innovation, as well as the impact and generalizability, and whether or not something could be sustainable. We've just completed the third iteration of the data challenge this month, and since 2023, we've obviously kept interest and participation very high. We have 20 different 20 different teams over the last 3 years have received awards, and you can see here how many have gone on to receive the awards, how many have gone on to publish, and it's just been really humbling, and it's been a real privilege to participate in this endeavor. And I'm going to pass it on now to our actual, you know, awardees to present on their work.
All right, can you hear me? Well, thank you so much for the invitation. I'm happy to be here. And yeah, so we got the prize, let's say, last year, as far as I remember. So I'm just gonna give you a quick introduction about what we've done and what we learned from this project. I'm glad to say that nowadays the teams have 60 days to perform this task, but when we did it a couple of years ago or something, we only had 30 days. So yeah, I'm still panicking from that. Yeah. So it was a massive challenge, you know. But anyway, so let's get it started. So antimicrobial resistance, AMR, is rising worldwide. So this is a huge problem globally. And then early detection of resistant changes is critical for timely interventions, but also for resource allocation. Most often, when we looked at the prevalence of AMR, we are talking about time series analysis. Most popular methods here are the ARIMA models, for example. They just looked at the changes in the average of the prevalence over time. But then we develop a framework that it's called generalized additive model. So it's a type of model that accounts for spatiotemporal components. So basically, the correlation between time and spaces. So we employ this framework in order to first try to build growth rates of AMR, which is a bit different than prevalence, and also to identify small changes in the growth rates of AMR over time. So then we can orientate, let's say, policy making after these. This is not magic, it's, trust me. All right, so that's the prevalence in Europe, for example. We just focus on analysis in Europe, 24 countries, and we use the Atlas data set. All the analysis was at the country level, so we looked at countries and over time defined as years. We employ these models that I just said to you, and then after employing them, we predicted the values, and in here, it's where the magic comes, you know. We did some mathematics, let's say, to compute the growth rates from the modeling scheme. Basically, what we found here, and again, try to trust me and follow me here. So basically, on the left-hand side of the picture, we find the prevalence of AMR over time, in this case, carbapenem resistance, Enterobacterales. Enterobacterales is a family of bacteria. And we see the prevalence in there. It was going down and then up and then down again after the COVID pandemic. But after employing our models, so we compute the growth rate and we detect change points that are being derived from the derivatives of the model. So this is, kind of mathematics, right? There is first order derivatives, so they are gonna indicate us when the growth rate, for example, was negative, and then it became statistically significant because it became positive at some point. And I've got the blue circles in there. But also, we've got other change points detected here in our growth rate. And we can see the yellow circles in there. And those are for the change points that follow an acceleration or deceleration in the increase or decrease of the growth rate. And also, they became statistically significant in there. So this is extremely useful, I think, because once we see this tiny change point that we cannot observe with just the prevalence, we can then take interventions or define, what are going to be the next steps for this. Another important thing here is that we computed growth rates. And once we have growth rates, perhaps we can find what are the main determinants or the main variables associated with growth rates. So in here, we've got the growth rate of carbapenem-resistant Enterobacterales, predicted from our module. And then on the other axis, we have got carbapenem use, so antibiotic use in daily defined doses. And as we move towards the right, we see that a higher antibiotic use is associated with a higher growth rate in carbapenem resistant, till we get to a saturation point whereby perhaps the population is already resistant. So even if we increase carbapenem use, that's not going to affect the growth rate anymore. And that was interesting, at least for me. Implications. So these type of models are extremely useful when it comes to real-time modeling because it enables early warning systems. For example, these models were developed for the COVID pandemic back in the UK, and we were able to spot differences at a very early stage. Also, we can identify high-risk regions, let's say, with these models, high-risk profiles in terms of social demographic characteristics and so on. And that's going to allow us to guide resource allocation. One example is even vaccination. This model supports national AMR action plans, and also it provides actionable insight for public health. Thank you so much.
All right, thank you very much. And as rightly introduced, my name is Akligoh, and I'm a grad student at Northeastern University, pursuing a PhD in bioengineering by day, but at night I try to focus on developing innovations that tackle problems like this that is so dear to my heart. And we happen to be one of the first student innovation winners for the Vivli AMR Data Challenge. And the project that we submitted that got us to win is the Microbase, an integrated AI laboratory assistant for bacteria and antimicrobial resistance identification. Again, Kasim had rightly underscored the global problem of antimicrobial resistance, so I'll not spend much time on that. But I just wanted to quickly highlight that the problems of antimicrobial resistance in the global south and the global north are very different. When you go to places like in Africa, people or laboratories still collect data on notebooks. There is incorrect identification, mostly due to human error. And they are also not using state-of-the-art methods that we see being used in these environments, right? So all of this can contribute to problems of antimicrobial resistance evolutions, especially in these problems. Again, because data is being collected on notebooks, most of the time they are untracked, especially by pharma companies that are developing these drugs, because we do not have just ways to fully understand this data. So these are some of the problems that we saw, and personally as a clinical laboratory scientist, having to first-hand diagnose these things, I realized that this was a contributing problem to antimicrobial resistance. But transitioning beyond that into research and innovation, I began to ask myself, what are some of the ways we could do, or some of the things I could do to contributing to closing that gap? And that is where the idea of Microbase came into mind, which I defined as microbiological information system. But at the heart of this are just models that we hope would allow easy bacterial identification, and at the same time helping to track antimicrobial resistance, which we aim to deploy over the web. So the algorithm or the workflow of Microbase is basically using laboratory-generated data of AST, because most of the low-resource environments still rely on biochemical test data. So my hope was that we could just leverage the data that they had, put it into our algorithms, and that would help them to easily identify bacteria. But at the same time, they also had antimicrobial susceptibility data that they were conducting. So leveraging all those data sets, we could streamline the bacterial identification problems using advanced algorithms that we were seeing. And using that as a means to generate data that eventually can train the models that we're developing to overcome the problems of identification that we were seeing. And by so doing, we could build the database that was being siloed, especially from places like Ghana, where I come from. And by so doing, we can also have other users. And once we had users using this tool, we can begin to bridge the data silos that existed. But I want to quickly highlight that the innovation that drove the development of this tool, the first part was largely simulated using a synthetic data set, but we got to a point where we needed to eventually develop the antimicrobial susceptibility testing portion, and that was where the Vivli AMR data came in. So we used the Pfizer Atlas data sets to crack that next part of the challenge. But I just wanted to quickly show how this tool works. if I'm unable to show that because of, sorry, I think we have internet issues, but if I'm unable to show that, this tool works by taking data, the biochemical test data, and eventually running that through our algorithms to eventually identify the isolates. And you can also query through the platform to ask questions about what kinds of resistance is this isolate harboring. And this, we hope, would make it easier for clinicians and people who are largely involved in public health-related monitoring to understand evolution of resistance backs as well as the antimicrobials that were being given. I think I'm having an issue with... Sorry. I think I just pressed something that just switched everything, but... Yes, okay, perfect, thank you. All right, so, I mean, the overall impact, we think that by developing such a tool, we can make it easier to track antimicrobial resistance by breaking the data silos that exist in places that are using this tool. And by having access to this data, we feel that we can share it, opening up discovery. And for me as an individual who is excited about the whole idea of precision diagnostics, we can leverage this data to develop tools that can serve specific needs for specific populations. And also by so doing, we can make it easier to track and trace antimicrobial resistance. Thank you very much.
Thank you so much to our panel. Really wonderful presentations that brings this to life. I don't need any slides, so. So I just have, I'm trying to keep us to time, but I really want to have a few questions for you. Especially for Kasim and Harry, how did participating in this data challenge change either the trajectory of your project or your collaborations or how you work with your teams? Could you talk to me a little bit about that and our audience?
All right, thank you very much, Rebecca, for your question.
Yeah, of course.
I think for me, it gave me some spotlight because I mean, Northeastern actually recognized us for, projecting the university to the world because we did this under the auspices. So I think that was one of the first things it gave me. Beyond that, as an individual, I think it just made me put on a different hat of thinking of solving problems globally by having access. And again, just by using a real-world data that was contributed by pharma, it gave us that vote of confidence in the tool that we are developing. So when we spoke to people, have you used any real-world data? And by just showing that, it proved that there was something that we're developing that was useful. So I think that was some of the things that I and my team that worked on this had achieved. Thank you.
Thank you. See?
Thank you so much for your question. So, yeah, first of all, well, we learned a lot. First of all, because of working as a team, you know, we had several people as part of our team. We had microbiologists, we had health economists, we had mathematical modelers. So learning from each other was a very rich experience, and that's one of the key takeaways, sort of like things, you know, from the challenge. But also nowadays, we have been in touch with other countries, let's say, on how we can automate this modeling framework, and then governments or maybe hospital settings can use them in order to spot these tiny differences and how they can allocate resources and even model whether an intervention is going to be cost effective or not, but based on what the model is telling you. So yeah, that's it from my side.
Thank you so much, Kasim. Mm-hmm. Question for you, Katherine, is, you know, Pfizer Atlas is really the flagship AMR surveillance platform and data set. One thing that really sets it apart, it has the most isolates from LMICs. And we've noticed that we've had a growth in researchers, perhaps a little different than our other data platform, from LMICs using data from their own countries. Can you speak to some of the challenges of Pfizer Atlas as you see in the future maintaining such an important resource for the community that is, of course, regulatory driven?
Right. So as I mentioned, this is regulatory grade data for a reason. Am I good distance? Okay.
Yeah.
Okay. It is regulatory grade for a reason. We have agencies around the world that require the data, but they don't necessarily require the data to be global. For the most part, they're just, for whatever reason, they don't think, bugs travel. So they're just interested in their regions type of AMR. But again, because of our extensive footprint in the anti-infective, with our extensive portfolio, we've had the opportunity to launch sites throughout Africa and in other LMICs and continue to host them because we do believe that microorganisms travel and recognize that needs to be addressed from a global perspective. What a concern in the future is, that if we do have to downsize or if we do face any, deprioritization in this space that is heavily deprioritized across big pharma, that we won't have the ability to keep up with the surveillance in these regions. So I really, really rely on things like this, these types of initiatives, and shamelessly will use your slide deck and, and I will parade them around and to really, show our leadership the impact that the data has across the world and, outside of just our regulatory commitments, really the impact that the data has and being able to see these tangible tools that are being created that are just, it's fantastic to see that, they're using this subset of this small amount of data, but they're going to use that as their backdrop as they continue to learn and feed their models with their own local data, and they have something that they can trust from a robust, perspective is really exactly what, I had envisioned and hoped would happen. And so I have to really continue to tell these success stories, and I've challenged the rest of you in this room to continue to spread the word, right, and continue to keep surveillance activities going in LMICs.
Absolutely. Well, thank you. If we don't have any online questions, we can go to the room. Steve.
Thanks. I was curious, for the data challenge, did the investigators go into Atlas and use the data from Atlas, or did the data come from Atlas into Vivli, and then the investigators are using it in Vivli? And I have a follow-up on that.
Yeah, Amanda or Katherine, you can speak to that.
I can take that. So for the data challenge, the data is on Vivli, the AMR register of Vivli, and so when they go in and they request it, we provision them the data set, and they're able to download it locally to their own device.
Okay, but is it getting updated regularly?
Yeah, we reach out to our members to get updates at about an annual cadence,
Okay.
and so Pfizer is pretty consistent in updating their data sets.
So one opportunity, and maybe you've already done this, and I'd be really curious to know if you did. The Gates Foundation, of course, has been distributing azithromycin like candy across the Sahel. And while you were talking, I quickly looked up. So in Mordor, there was almost 200,000 patients. In Reach, there's 1 million. And in Avenir, there's almost 400,000. And at least in Reach, they all had nasal and rectal swabs as well to look for resistance. It was actually one of the outcomes after Mordor.
Right.
And I'm just curious if that data is getting ingested into this platform and also into Vivli, because it would be a tremendous resource. It's a massive, massive data set.
It has not, but thank you for the tip, and we will certainly contact the foundation.
I think it's a worthwhile follow-up.
It sounds like a very worthwhile data set. And now they know there's a home for it.
I think that's really the very important point, Rebecca, is that there is a home for it now. And having it all live here on the Vivli AMR register has been really, really significant in moving the effort forward.
Yeah, and Pfizer was a partner in the study, so they've been cooperative. So there's huge opportunity there.
Yeah.
Thank you so much for calling our attention to that. Any other questions before? Yes, in the back.
Hi, sorry, I just have a question for Harry. So I guess the microBIS, would that basically replace Vitek or MALDI-TOF for low-income countries? If you detect from biochemical and you can say EST, then they won't have to like spend resources on buying those tests?
Yeah, I mean, that's one of the goals that we anticipate. Again, there are state-of-the-art, right? And those tools are state-of-the-art, but at the core of what we are doing is data, right? So we want to still ensure that we collect the right set of data that eventually is used for building this tool. And when we have that level of confidence with the tool, then we can begin to shift people's use of those tools over to ours. And by so doing, we can cut down drastically the cost that those employ on the users. So that's the goal, but it will definitely take time. Thank you.
Great question. Thank you. Okay. With that, I want to thank you, our panelists, for their presentations and our wonderful discussion.